Hello everyone, my name is Apollonia Robertson, and today I'll be discussing how evidence-based practice relates to several common situations we encounter in healthcare. I'll also share my thoughts on the reliability of evidence and the role technology plays in bridging gaps between research and clinical application. Looking at the examples provided, I see a clear pattern. Clinical decisions are often being made from limited or anecdotal evidence rather than from robust research. For instance, using a silver-infused dressing based solely on in vitro antimicrobial activity does not necessarily translate to improved patient outcomes. In fact, according to the Melnick hierarchy of evidence, in vitro findings are considered level 5 evidence, which is far less reliable than systematic reviews or randomized controlled trials, or RCTs. Before widespread adoption, we need large-scale clinical trials to confirm efficacy and cost-effectiveness. The same applies to the ganglion block for spinal headaches. A single case report represents level 7 evidence, which may be useful for generating hypotheses, but not for guiding practice. Evidence-based changes require replication and validation across diverse populations. Similarly, implementing a new surgical prep protocol based on one study could be premature. Ideally, practice changes should derive from systematic reviews or clinical practice guidelines which synthesize findings across multiple studies to reduce bias. The examples involving social media are especially concerning. A coworker refusing vaccination due to anecdotal stories of hair loss, or clinicians adopting unverified techniques from online groups illustrate how misinformation spreads rapidly in the digital age. Social media often amplifies confirmation bias rather than critical appraisal of evidence. Lastly, the attitude of "I've always done it this way" reflects one of the biggest barriers to evidence-based practice, and that is resistance to change. Other barriers may include the lack of time, limited research literacy, and an organizational culture that doesn't prioritize evidence-based practice. To bridge these gaps, we must foster a culture of inquiry, promote access to clinical decision support tools, and enhance nursing education and evidence appraisal. Technology like PubMed and Cochrane Library has greatly improved access to high-quality research. However, it's only beneficial when clinicians know how to critically evaluate the evidence they find. In summary, the most reliable evidence comes from systematic reviews, meta-analyses, and well-designed RCTs.